Hey Facebook, it's Fox 42's Katie Blaze. I am here at the University of Nebraska Medical Center today talking about some new clinical research that's going on that will hopefully one day treat the cause of Parkinson's disease. Now, Parkinson's disease is something that affects a lot of people in Nebraska, and right now I'm going to turn it over to Dr. Pam Santamaria to tell us more about this new clinical research.
Yeah, hi, my name is Dr. Pam Santamaria, and we are here today discussing our new clinical research that we recently published. It's a really exciting study. It's a novel approach to the treatment of Parkinson's disease. Most treatments that we've had in the past have relied on treating the symptoms of Parkinson's disease, such as medications or surgery. Our study today shows that we have a new novel way of treating Parkinson's disease, and that we're actually going to treat the underlying etiology of the disease rather than just treating symptoms.
Now, how many patients were part of this clinical study?
So there were about 20 Parkinson's patients that were enrolled in this study. 10 of the patients received a placebo, and 10 of the patients received a medication. The medication was done through an injection, so patients were required to give themselves self-injections for about 8 weeks.
What were some of the results?
So we saw improvement in a majority of our patients. Patients showed benefit in regards to their tremors, to their mobility, their dexterity. Patients were able to stand straighter and get around from point A to point B. We were able to notice it in our clinic. Patients were able to notice it, as well as were their caregivers and loved ones.
Why is this such a big deal for not only UNMC, but for anybody who is dealing with Parkinson's disease?
Well, this is exciting because it's one of the first studies that actually shows us that we may have a way to actually treat the etiology of Parkinson's disease rather than just treating the symptoms. And we've never had anything quite like this before.
And what's the next step for this?
So the next step is that we plan to go to a phase 2 study of Parkinson's disease. It'll start in probably a year or a little later than a year. Our next stage will be an oral pill instead of an injection. We will probably be enrolling about 200 patients with that study, 100 which will receive medications and about 100 that will receive a placebo or no medications.
Last question, what are your emotions today presenting this to patients, other doctors, family members?
I think it's just super exciting. I think it's exciting to be a part of it. I'm excited for our community. I'm excited for the Med Center. I'm excited for our patients, our loved ones, our caregivers, and I'm really hoping this will establish something that we'll see and kind of set a baseline for future research and hopefully a potential treatment that works better than the medicines that we have down the road.
Thank you so much.
Thank you.